Hi, I'm Dr. Avantika Tripathi, oral and maxillofacial surgeon, course mentor at Dentium. Today, I will be explaining about the prosthetic procedure of Dentium SuperLine implant. So, today I will be doing the prosthetic procedure in this dummy model in which I have already placed an implant in the premolar region. The implant's diameter that I have placed is 4 by 10, 4 mm diameter and 10 mm length. So now first of all I will be placing the healing abutment. So this is the healing abutment which is available in different diameters and different gingival height. So the diameters and gingival height can be chosen depending on the tooth position and the depth of the implant placement. First of all, I will be placing this healing abutment over my implant with the help of this hex driver. So I will simply screw it over my implant with the help of this hex driver. After 1 week, I have to remove the healing abutment, and after removing the healing abutment, I will see a nice gingival collar will be formed around the implant. After removing the healing abutment, we have to take the impression. For the impression taking, there are two types of techniques. First is the open tray impression technique, second is the closed tray impression technique. So today we will be discussing about the closed tray impression technique. So these are the closed tray impression copings. These are available in two variants, non-hex and hex. The hex impression coping is available in two parts. This is the screw and this is the impression coping. So we have to fit the impression coping first and slightly twist it so that the hex of impression coping fits in the hex of the implant properly, and then we can simply put the screw of the impression coping over it and tighten it with the help of the hex driver. So a properly seated impression coping will not be loose, it is properly seated inside the implant. Hex impression coping is used in single implant cases, whereas non-hex impression coping is used in those cases where implants are connected with each other. Let's start taking the impression. So I'll start taking the impression by putting the light body over my impression coping and throughout the arch. Then I will be putting heavy body over the impression tray and I will be putting the impression tray. A gentle uniform pressure has to be applied over the tray. The material is set now, so let's remove the impression. So I'll remove the impression very gently. After removing the impression from the model, I will remove the impression coping over the implant with the help of the hex driver. I will simply unscrew the impression from the impression coping and I will remove the impression coping. So after removing the impression coping, I will simply fix the impression coping with this analog. An analog is the replica of an implant inside the cast. So I will simply fix the hex of the impression coping with the hex of the analog. So I will simply twist the impression coping to engage the hex with the hex of the analog, and I will screw of the impression coping tightly. Flat surface on the impression coping. So this flat surface indentation comes in the impression also. So after fixing the impression coping with the analog, we have to insert the impression coping matching the flat surface with the impression. So after making the impression, the gingival mask is formed and the master cast is fabricated. Over the master cast, the implant crown is formed. Once the crown is fabricated, it is placed into the patient's mouth, and by this the procedure is complete. If you like this video, please like, share and subscribe to the channel. See you next time.